So basically, it's been confirmed by Dr. Zweli Mkhize that there are 2 South Africans in China who are being quarantined. They don't necessarily have it, but they have to check if they have it for the disease or the virus, pardon me.
That's right. These were 2 South Africans who had moved from Wuhan City, which is the epicenter of the virus where it was first detected, and they'd moved to Tianjin. So that is where they've been quarantined at this point. And quarantine doesn't necessarily mean they're being taken to some camp or anything of that kind, no. But what it simply means is that their movement is being restricted at this time. And I think that's the first point of ensuring that this virus doesn't spread any further. I mean, you're talking about a death toll of over 200 currently, and at the World Health Organization briefing in Geneva last night, you were looking at a death toll of about 170. So the numbers are rapidly increasing. So the first point of course, trying to ensure that the virus itself does not spread would be to quarantine people. So we know, of course, that there have been multiple South Africans who had been living in Wuhan City, and quite a number, of course, about 3,000, I understand, to be living in China. So the concern for the South African government at this stage is to ensure that it does not spread towards our shores, and also ensure that the South Africans who are already finding themselves in that situation are safe. What has also been done is that the Department of International Relations has also been in touch with those South Africans, but certainly as there's more calls for there to be no panic as the number increases, the number of dead increases, and as it continues to spread, certainly around the world, countries including South Africa, who are responding today to the World Health Organization's decision to declare an international emergency, saying that they're going to make sure that everything is put in place to screen all the travelers who are coming in particular flights from China at the country's ports of entry.
Yes.
In particular, I think what's important at this stage, how severe South Africa also seems to see this problem, is deploying the South African military service, health service to the ports of entry, which indicates that South Africa is determined to beef up the numbers currently at the ports of entry at your airports, big airports like OR Tambo International Airport, to beef up the number of people to screen there and make sure that the virus itself is kept out of our shores.
But some may ask, how serious is the government? We're hearing of governments the world over sending their military forces to go and get their people out of Wuhan City, and the South African government has decided that for now they're not going to do that.
And Norma, that was one of the critical questions that we asked. When will South Africa decide? I mean, given that the World Health Organization has declared this an international emergency, when are they going to assist South Africans? South Africans who we understand through other reports remain distressed in parts of China. But South Africa is sitting with a problem at this stage where it has come up with quite a number of hospitals. In fact, hospitals in all of the country's 9 provinces in the event that there is that kind of national threat to South Africa. But in terms of the South Africans there, they maintain that there is no need at this stage for restrictions on travel as well as trade. And the South Africans who are there, in particular those who are in Wuhan City, those of course would need to go through the 14-day quarantine process to make sure that they don't have those flu-like symptoms before you're allowed to travel elsewhere. But they say that the Department of International Relations is in touch with all of the South Africans who are in China, those who are living and working there, and they seem to be quite confident about the communication, the two-way communication that is happening currently. But in terms of the hospitals that have been identified, should this become a national threat? I mean, you've got hospitals like Tembisa, Charlotte Maxeke. If we talk about Tembisa, just a couple of days ago, I was reporting on a story where 10 babies had died due to the Klebsiella pneumonia virus. And one of the critical issues that was put on the table was that South Africa, or that particular hospital, Tembisa Hospital, was so overwhelmed, with patients and understaffed that, it was very difficult for it to contain the situation before the 10 babies had died. So you want to go and get another problem, which is much wider and global then the 10 babies, not that I'm dispelling, the 10 babies are passing away, but a global problem. We've agreed to also assist in terms of testing some of the suspected cases on the African continent, but then to bring, in the event that it does happen, some patients to some of these hospitals which are clearly ill-equipped. And it's an acknowledgement by both the Gauteng Health Department and the National Health Department.
Well, did you pose this question
I
to the
certainly
Minister?
did. I posed it during the course of the first press conference that was held, and one of my colleagues pressed on the issue again today. But what the department is saying is that this would be one section of the hospital, or one part of the hospital that would be quarantined, which would need not many staff, but those who will then have access to that particular point. But I think it's still raising eyebrows. How are we going to be able to deal with a situation where, if indeed we do find ourselves in a situation where there's a national threat, how are we going to deal with it when the hospitals that we have currently, in particular the ones that have been mentioned, including Tembisa, don't really have, according to what we understand now, enough staff to take care of a situation like that. But the department really dismissing part of our questioning regarding that.
Isn't government looking at also perhaps doing a public-private partnership with the private sector in terms of hospitals that are available there, because they will have the requisite staff, won't they? Nothing
said about that, Nompo, but I think, in a situation like this, every country needs to reevaluate as the situation continues.
Yeah.
I mean, the World Health Organization announcing yesterday that this is now an international emergency. A couple of days ago, it said it would decide. So this is a situation where, as the death toll rises and it continues to spread to more countries outside of China, it raises more concern. So probably South Africa would need to look at that option if it does present itself as a national crisis here at home. I think it will spare talks between different individuals would need to take place in the event that they find that some of the hospitals which are designated currently or have been placed as hospitals that will take care and manage this crisis in the event that it reaches our shores, if that does not work, certainly something like that would need to be engaged on.
I know that you watched the World Health Organization's briefing closely yesterday. It seems ironic that they should declare this an international emergency, but at the same time not recommend that travel and things like that be curbed. It should be business as usual. I find that quite ironic. Did they explain why that's the case?
No, but I also found that quite ironic because, I mean, the chief of the World Health Organization during that briefing had said that, them declaring it an international emergency doesn't mean that this is a vote of no confidence in China. They believe that China has done enough to curb the spread of this virus. But what is clear is that I think it was about 2 days ago, the World Health Organization representative here in South Africa had already told us that it had spread to 14 countries outside of China. And I think there were about 98 new cases outside of China, but no deaths, confirmed cases. So if you're looking at the World Health Organization also saying in that press conference they're not worried about what's happening in China, but the reason they took this decision is because they're worried about the effect or impact it will have on weaker health economies. And some of those weaker health economies are where? On the African continent. So for you not to then restrict trade or travel for a minimal period until you have a clearer understanding of what's going on has certainly raised quite a lot of eyebrows. And as we continue to engage with the World Health Organization, I think they would probably, if the death toll rises, would probably need to reconsider that move, because it is drastic, yes, to cut off international aircraft. Some countries have already done it because they're trying to avoid a situation where you have a continuous spread of the virus itself. Why South Africa has not taken that stance really boggles the mind at this stage. But they're giving the reasons that they're putting forward. We'll certainly need to see how it all unfolds. The death toll continues to rise. South Africa has put its own mechanisms in place to respond to the decision of the World Health Organization. But nothing drastic, very drastic on the part of South Africa.
Yeah.
It is quite mind-boggling. We'll have to watch it unfold over the next couple of days to see if South Africa will change its stance.
We didn't touch the detail about the SANDF that are going to be deployed at key entry points to the country. How many are there going to be, and how are they going to be working with the civilian workers and so on?
All right, no decision yet on exactly how many. In fact, the deployment, according to the Health Minister, Dr. Zweli Mkhize, will possibly begin today. So this is to beef up on the number of port health authorities that are already stationed at our ports of entry. So you have a situation where you probably have a few, it's actually the military health service, the South African military health service, that will be assisting. So this is to beef up the numbers to ensure that nobody goes through our ports without being properly detected. If somebody is detected, a nurse will have to see them on the spot. If it is found that their temperature is way above normal, they will then be taken to the necessary places where the necessary checks will be done. But, I think quite a good move on that part, which really shows South Africa's seriousness in dealing with this particular issue, because we've always been accused as a country of being reactive and not proactive in this instance. So the South African government certainly does not want to be seen to be reacting and not trying to put measures in place to ensure that in the event that something happens, they would have done everything in their power to make sure that they try to avoid a situation if indeed it does happen.
Yeah, and it is very important for South Africa because we are so connected to the rest of the globe.
Correct.
We have millions of people coming into the country from all over the world.
Correct.
So it's important that we safeguard. Thanks very much, Chriselda.